Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health on Power 96.5 WUFO. Who is Kaleida Health? We are the hospitals. We're Buffalo General Medical Center. We're Oishei Children's Hospital. We're the Gates Vascular Institute. We're Millard Fillmore Suburban Hospital. We are the Visiting Nursing Association, often referred to as the VNA. We're DeGraff Medical Park, and we have clinics throughout Western New York. We have clinics for all ages, and as well as our specialty clinics, such as our pediatric clinics. We have two of those. We have one at Niagara, on Niagara Street on the west side, as well as our pediatric center on the east side. But we also have clinics right there for children at our building at the corner of Main and High Street. And one of the physicians, please remind me, because that name just popped out of my head. And so I just want to thank everybody who is part of our Kaleida family. And I would be remiss if I did not mention our two long-term care facilities. That's one at High Point. That's High Point at Michigan. And also we have our other facility in North Tonawanda, DeGraff. But I just also want to say we have physical therapy facilities and clinics, and we, diabetes, endocrinology, and I can't forget the Great Lakes Cancer Care Collaborative, where we see not only do we treat the patient, not only do we have surgeries, we have social work, we have support groups. So Kaleida Health we are part of we recognize many of our patients and their family members do have cancer, and we are here to service you with screenings and everything. If you're interested in watching any of our past videos of this program, please Google www.kaleidahealth.org/videos. And our interviews cover a range of topics and all ages. And Kaleida is also available for outreach, speaking as well as speaking engagements, both personal and virtual. And also, I just have to mention, Kaleida is hiring. We are hiring for all positions within all of the hospitals that I just mentioned. And remember, because we're open 24 hours a day, 7 days a week, if you're in school or if you're taking care of children or taking care of loved ones or parents, we have, more than likely, we have a schedule that will fit your needs. And that's full-time as well as part-time. Well, today, because we are going into, what is this? We're going into summer, but also summer, I also think of school. So today we are going to be discussing our UB Medical School, talking about programs that the students are part of, and they're part of the community. We have two of our top physicians on our program today, and one is Dr. Kenneth Snyder, Dr. Snyder, who is MD and PhD and several other, he's a surgeon. Dr. Snyder is a surgeon in the stroke department, and he's also assistant professor of neurosurgery at UB Medical School. And we have Dr. David Milling. Dr. Milling, could you give me your title, please? Besides being a great physician, what is your title?
Sure, happy to. Good morning. So I am the executive director for the Office of Medical Education and an associate professor, and I'm a primary care doc.
Oh, okay. Oh, yes. And I have to say that both Dr. Snyder as well as Dr. Millings have been part of the Great Lakes, different programs, part of the Great Lakes Health program. So I want to thank you both. And the program we're going to be discussing today, before we talk about the title, I would just like for one of you to just give a brief historical overview of our great institution, UB, and that of the medical school.
Yeah, so I'll take this one. So it's a long storied history, as you can imagine. Right? So it's interesting to note that the medical school was actually founded in 1846, and the medical school building was actually on High Street. So it moved from High up to the South Campus at the Main and Bailey uh, location in 1953, and then moved back down just steps away from the initial building across the street here in 2017 to the new building that's again on High Street. So in that period of time, obviously, lots of changes. Most recently, our class size has gone from 144 to 180 students every year. So we have a big class. And I think that, again, being back down here on High Street has been an opportunity for us to renew our focus on our connection to the community and how best to interact with the community as the medical school with all of its assets and all of these amazing motivated students that we have that are so anxious to be a part of improving healthcare in our community.
And along those lines, are the majority of students from Buffalo, or do they come from across the country and around the world?
So that's a great question. It's one of the things that is really important for people to know. We're a state institution, and we're committed to training students from Buffalo, Western New York, and New York State. So for incoming class this year, we're actually going to have 45% of our students are going to be from Western New York. So that's almost half the class. So that's our commitment. We want people to train and stay. And let me just say that again, and stay in Western New York, right? To help to take care of our patient population here.
Although medicine is universal, we just, like you said, we would just rather that they stay here. And as Absolutely. I call it, the new Buffalo.
You said it.
And Francesca, I'd like to give a perspective of someone who was blessed to have been enrolled in the medical school in the past year, trained here and stayed, and really fortunate to have been given that opportunity and learned from incredible mentors. But I think what makes today so exciting is that under Dr. Milling's leadership, along with Dr. Lessie, Dean Brashear, Lisa Jane Jacobson, Dr. Jacobson, and Dr. Mecca, as well as the entire academic team that teaches medical students, we are currently undergoing a transformation of how we think about community and think about care and think of the role of the medical student. What's exciting for me is I've had the opportunity to learn from Dr. Milling as he sat on Quality Committee, the board chair, and constantly pushed for how does the healthcare system continue to engage the community and do more for the community and continue to engage the medical school. And in his unique role, he's helped us come up with very creative, very innovative, very exciting ways of experiential learning opportunities, learning from more than just being in the books. And it's amazing how creativity and innovation feeds energy into everything that we do. We used to, back when I went through medical school, only be taught about disease processes and then spend time on clinical wards. Under this incredible team's leadership and Dr. Milling's leadership, we are adding two other core pillars to the medical student training science. We're learning about humanities in ways of how we empathize and connect with our patient population. And we're learning about the system of the healthcare, how it's delivered, the science of its delivery, because the vast majority of time, We may know what we want to do, but there's a failure in engaging our patient, having them help us with the action plan, and truly understanding their problem and why it may not be followed up upon. And we never used to get taught that stuff. And by Dr. Milling and our curriculum development team's ability to put our medical students early on into communities where patients are struggling with chronic care conditions and medical care, they are learning right out of the gate a sense of where the problems may be. What's most exciting to me is that most medical students thought their job eventually was to take care of the patient that's in front of them at that moment. What is transformative about what's happening now is a citizenship and an ownership that we are training medical students of the future to take care of the person in front of them, the community around them that has similar diseases, and this really is a switch that flips to improve the broken healthcare system around us. That when they sign up to be a doctor, they're signing up to do all of those things. And that's incredibly exciting to be on the cutting edge of beginning to treat and interact with our medical students that way. Under Dr. Milling and Dr. Jacobson's leadership, we are doing as much interprofessional experiential learning as we can, and would love to pull community into this. Because when we get into the workforce, we don't work in isolation. Working with the nursing students, the dental students, the public health students, along with, again, the medical students and other, as a group, especially pulling community in. That's how we work most effectively in the workplace. And one thing that Dr. Milling was helping me with, or helping us all with, is we were thinking this through. When we try and teach our colleagues these things that are 20, 30 years into practice, the penetration is really difficult. Dr. Milling said, 50% of the people that go to the school might be from Buffalo. Adding on to that, up to 50% stay. So when we make the impact in their knowledge base, it will directly translate into change and into impact in the care we provide. So I'm sorry to cover a lot, but I learned so much from Dr. Milling. I'm so excited and passionate about what this is going to do for our community in the coming years.
Yes, and I just want to add one thing, which I think is excellent, because I know what you're doing. I mean, I do not know exactly, but I know my primary care has medical students, dental students, different students interacting with the patient. But I just thought about something. And what if all of the different students, the medical students, the dental students, and all the students that fall under this umbrella, and I just recently read something, it was 8 questions to tell your physician, not to ask, but to tell your physician. Have you told your physician this? Such as, are you depressed? Are you taking any other medicine? Are you taking like a vitamin? And because before it was ask 3 questions, and I always thought that was never enough. But I really enjoyed reading this piece. I think it was from the I can't even think where it was from, but I know it was from a legitimate source. And it said 8 things you should tell your physician about yourself. So I'm just thinking, if the students, saw in different capacity, and what if the patient in the community received that same card, 8 things to tell me, 8 things you need to tell me. The patient needs. Eventually they would say, oh my God, here's that card again. Oh, let me make sure that I know this. Because I've always said doctors, and that's why I really like this program called the Immersion Program, because doctors are not mind readers. That's what I tell people sometimes working in the community. They'll say, well, I don't, during outreach. And I'm like, well, did you tell your primary care? They're like, no, but I'm like, okay. But anyway, let's talk about the Immersion Program. And if you could just let us know, like, what is that? And is that new to the thought of medicine, like Dr. Snyder just talked about, the whole interacting with community? Is that new? Is that a new program?
So I don't think the concept is new. I think that we're just at a point now where we realize that, as Dr. Snyder so eloquently said a while ago, if we're unable to connect with the community, then we're not going to be able to deliver the care that we want to deliver. As medicine explodes in terms of knowledge, we've come to realize that, we are able to, we have all of these amazing devices in front of us where we can get immediate answers as it relates to some of the knowledge. But the other parts of medicine related to the community and the social determinants of health, which are so important in terms of caring for individuals. If we're unable to do that, then we're not going to be able to meet the mission that we want. So Dr. Snyder is entirely correct. As you speak about the immersion program, a lot of this that Dr. Snyder has framed is what we're trying to integrate into a new curriculum that will actually go live in the fall of 2024. As some of the things that we've tried over the years that are so important to kind of infuse into the new curriculum is an elective that we've had that's called Health in the Neighborhood, which is what I think you're referring to as the immersion program. So we actually are based out of Hopewell Baptist Church. And so we have this amazing opportunity to have our community coaches or our community teachers interact with medical students. And we have a group of about 25 every year who go into the community, not with stethoscopes to ask, what you want or how we can treat you, but to learn from the community about the barriers to care that are so evident in many ways from individuals, and to learn from those individuals also their experiences with the healthcare community, and then have those conversations together about what we can do to help to improve the health of community members. So, when students begin at this level to have those conversations, be comfortable with individuals who they're going to take care of, and understand what the community and the barriers and the opportunities that are available, then we're able to move things forward in a way that we have not been able to do prior to this. And I mean, it goes back to your point. We also, in those conversations, empower the community members to understand that this is a partnership. To your 8 questions, right? If you're not able to have a conversation with your physician about what is important to you, and it's you are deferring to your physician, listening but not executing the plan because you don't believe it, and you have questions that you have not asked, then that's not helpful to anyone.
Fran, building off a couple of Dr. Milling's comments and a theme to some of the prior shows we've done before, I think one of what I love about what you bring to this program is actionable things for the patients or the people that are listening and what they should be doing for their doctors. The first one is we need to continue to reiterate, we work for them. They pay us for a service. And so the mindset of I'm afraid to bring something up. No, we work for you, and you have to approach your care from that perspective. The second, Dr. Milling and the team are really pushing a curriculum of prevention and wellness that has not been in our curriculum before. We learn about disease processes and how to treat diseases. We don't learn about what wellness means or how to be well. And the healthcare system will be doing its job when we keep you away from us. We should only be a repair shop for the repairs that are absolutely necessary. And the mindset of the curriculum, the teaching of diet, and to Dr. Milling's point, the healthcare system and the University of Buffalo have incredible ability to influence. And so I'll give you an example. When we hear from community that my Medicaid cab showed up 6 hours later, I can't get in on time. The sidewalks in my community are all broken. I can't walk it. Well, part of the problem in community development has been who owns it, who's accountable, and how do we fix it? Part of this community network is to say, we know that for your health, we have to engage in those problems with you to help get them fixed. for the greater benefit of the health of the community. And this conversations and these work give us the data to help empower us to help the community hold those groups accountable that are supposed to be helping us get that built community work done.
And I just have to say that you talk about the sidewalks. Another hat that I wear, executive director of the Near East and West Side Task Force, that was something that came up 21 years ago in the findings about health in the community, or lack of. The sidewalk conditions, that will be a glorious day when there's I'm sure we can't improve them all at once, but when a significant number of sidewalks, because not only are sidewalks for walking, they're also when you push your baby carriage. You're putting your life, that of your child, at risk when you don't have safe sidewalks. So, don't get me to say the safe sidewalks, but social determinants of health. I want to make sure our listeners have an understanding of what that is. We hear it in the news, see it all the time. Could one of you give a brief overview of why social determinants of health are important and what it is? What is it?
Yeah, so these are all those factors that actually play into making you healthy. I mean, I think you just said we just spoke about one of those things, right? I mean, and let me just, before I get right back to your question, let's stick to the sidewalks for a second. If the students don't understand that you're asking someone to exercise and they have not walked in a neighborhood and seen what it is like to try to get from point A to point B without access to sidewalks, etc., then there's just a disconnect. So this is so important. But back to your question about social determinants, we need to think about housing. If individuals are not able to have safe, affordable housing, then that's a stress on their health. We need to think about education. If we're not able to educate our young people and to have them understand, to be able to understand what is important for them to succeed, and also what is important for them to impact their health, we're not going to be able to have a healthy community. So it's these other things apart from medicine that are so important to people actually staying well, as Dr. Snyder said. We want to be preventive. We don't want to be dealing with illness. And so unless we address all of these issues, food insecurity, right? If we're unable to address these issues, which are the social determinants of health, we're never going to progress the way we want to.
And that's just, before you join, I just want to say, if you're just joining our call, we are the program, we're talking about the new UB Medical School curriculum and the things the students are learning. Go ahead, Dr. Snyder.
Again, learning from Dr. Billing as he sat at Quality Committee of the Board Chair. One of the things that he kept pushing was, you're not going to make improvements on any of the areas you want to improve unless you have data, and the right data, to be able to develop smart action plans and smart goals. And so one of the biggest keys here is the healthcare system and the doctors in the community, the system across the board, collecting appropriate data on these categories of social determinants, so that as we look at health outcomes, we can then subcategorize and look under those outcomes to say what patient population groups are doing well and not doing well, so that we could target our energies and efforts to close those gaps and disparities. When we talk about disparities in health, it isn't just a racial term or thing. It is all of these elements. And so first thing we are working on as a community and as a healthcare system is capturing this data. And it's not easy to talk about. And many physicians may or may not feel comfortable talking about it. But there are standardized forms and standardized methods. And as we work with our new students, what we're working on is what is an appropriate way to listen and engage our patients to learn what elements and factors may come into play to impact their future outcome of a health disease process. We've got to capture the data, then develop the action plan. But again, micro, I need to think about that and do that for the patient in front of me. Macro, I need to think about that as a disease process for all of the population in the community that has this, so that I can look at the larger picture, we partner with Erie County Department of Health, partner with all the nonprofits in the community. It's going to take this level of trust, connectivity, and focus, because it is a huge undertaking, and outcomes take years to achieve. Right?
Yes, they do. And I want to say we are almost out of time. So in a couple of really like two words, why should someone apply to UB Medical School?
So a great question, right? And I'll start with saying that the first thing that they need to think about and not be afraid of is the winters in Buffalo. Right, Buffalo is an amazing place. We are definitely a community. We continue to face the challenges that are ahead of us, and continue to work on those. So it's big picture, but more importantly, at the medical school itself, you're going to get an amazing education, not just about the pathophysiology of disease, but as we have said over the past half an hour, how do you integrate that into the community, understand the community, and actually influence the health of the community by working directly with the people in the community to make us better.
Thank you. Dr. Snyder, you have 10 seconds to say why someone should come here.
We're teaching the doctors of the future, not of stagnation or of the past. And sometimes people are hesitant to go to a place undergoing change. It is all about comfort with change management for our future. And I think that's what our students need to learn and be a part of.
Thank you. And I just want to thank Dr. Snyder and Dr. Millington. These are physicians. We're talking about housing and education and nutrition. The change is here. So I strongly encourage you to come to UB Medical School and apply. I want to thank you both this morning for taking time to be part of the Great Lakes Health Radio program.
Thanks for all you do for us, Fran.
Thanks for having us.
And I just want to say next week, you'll hear from my esteemed colleague from ECMC, Cindy Bass. And in 2 weeks, you'll hear from me, God be willing, Francesca Messiah from Kaleida Health. And remember, Kaleida is hiring. Come grow with us. Come grow with Kaleida. Thank you. Bye-bye.